Measles researchers say a nationwide immunisation catch-up program for people in their teens, 20s and 30s is the only way to stop the frequent epidemics hitting New Zealand. So far this year, 142 cases of measles have been confirmed, the fourth significant outbreak of the disease in a decade. Researchers say people born between 1982 and 2007 are part of an immunity gap with extremely low vaccination rates, and that's got to be addressed. Kate Newton reports.
Cameron Edwards' memories of being in hospital with the measles when he was 14 are hazy, but he remembers the moment he realised just how serious it was.
Kind of all hit me when they started to say, you should probably get your family to come in and start saying their goodbyes and stuff, and had some friends from intermediate and stuff come over and stuff, and that's kind of when it all got real, and I kind of clicked on when I started seeing everyone come in and, being a bit extra friendly.
Cameron was one of 600 people to contract measles during a 2011 epidemic, and it took him 2 years to fully regain his health. He's among a group of New Zealanders, those born between about 1982 and 2007, who have much lower rates of immunity to measles than the rest of the population. David Heyman, who's the director of Massey University's Infectious Disease Research Centre, was part of a team that tested just how low those rates are.
Even when we take the best estimate, some of these children that are now at high school, we've still got 16% of those that we think are susceptible to measles. There were some cohorts where we got down to having 22% of those year groups that we thought might be susceptible, and those are people born between 1991 and 1995, and so that's really low.
Childhood immunisation rates have dramatically increased in the last decade. The Immunisation Advisory Centre's director, Nikki Turner, says 91% of all 2-year-olds are up to date with their vaccinations, close to the World Health Organisation target of 95%.
However, the damage has been done historically, and we have an awful lot of young adults and midlife adults walking around who are unaware whether they have or haven't had measles-containing vaccines. That is where our major problem is coming from.
Dr Turner says there are several reasons for those low rates.
The main reason was our systems did not deliver well to people, so people missed out. Alongside that, there was a prevailing myth at the time around a concern about measles-containing vaccines and autism. That was actually one effect. The bigger effect was that our systems did not deliver well.
Cameron Edwards' mum, Ali Edwards-Lazenby, chose not to vaccinate her son based on that now discredited study linking the MMR vaccine to autism.
It was conversations with other parents. It was on the news as well, and being in my field, working with families with autistic children, I knew some of the challenges.
Nikki Turner says whatever the reasons for the low rates, the health system has to address that immunity gap if it wants to prevent imported cases of measles from spreading in New Zealand.
New Zealand, I believe, needs to offer at least a single measles-containing vaccine to everybody under 50 who does not have a clear record. You can practically target it by geographical areas and by age groups. We know that the higher rates are in people under 29.
Dr Heyman would also like to see his research recommendations put into action.
I think, yes, have a big catch-up scheme, and then the good work that's happening at the childhood immunisation levels will really be so beneficial.
The Health Ministry's Director of Public Health, Caroline McElnay, says the ministry is interested in the idea but hasn't put a timeline on it.
Whilst recognising that we've got an immunity gap in an older age group, actually we still need to keep our focus and our attention on our immunisation schedule, which is vaccinating our young, because they're the ones who are the most vulnerable. But also it's about then not creating a new immunity gap going forward.
The Health Ministry is currently reviewing a recent public health campaign in Canterbury, which resulted in 27,000 people getting MMR booster shots, including about 10,000 teens and adults. Mō te hōtaka o te ahiahi, ko Kate Newton aho.